I am going to pull up, our first speaker is going to be Fran Norton. And Fran is a Charlotte County resident and wants to speak against the ordinance.
Thank you, Mr. Truex. And I am going to pull that down like that.
There you go.
Yes, please.
My name is Fran Norton. I'm a registered nurse. I am actively employed full-time for a major insurance company. I've been a nurse for 45 years. I've developed an infection control program for a 100-bed hospital 30 years ago. Yes, I'm dated, but it's still experience. What I do right now is a certified nurse case manager, and I talk with people all over the country about their health and their wellness choices and their all types of issues. What this is an emotional discussion that I've heard to this moment. I like the fact that you incorporated our police into it to ask if they have the ability to enforce it. That is really like a cornerstone of the decision. I'm thankful for that. But I would like to present from a nurse point of view and from the CDC, from the Center for Infectious Disease Research and Policy. We've got this whole thing has created such an economic and social, behavioral health. It's caused PTSD in many people. It's caused violence in public because of the pent-up feelings and emotions that people have, and in private. This is truly an issue beyond the scope of a county or anyone else to really make an educated, massive decision like this. So I'd like to offer from April 1st of 2020 that surgical masks likely have some utility as source control, meaning that the wearer limits the virus dispersal to another person, from a symptomatic patient in healthcare settings to stop the spread of large cough particles and limit the lateral dispersion of cough particles. They may also have very limited utility as a source control in PPE, in households and in public. Leakage around the face pieces is known, so the mask you're wearing is great. And I wear a mask in public in certain situations. I was given the opportunity to not have to today, and I am very thankful that the courthouse has, or this building has that ability. But in your mask you're wearing, you're not spewing directly out, although it's like a chain link fence trying to keep back mosquitoes. The viral particles are so minute that they do get through any mask that we have, except perhaps some of the more respirator type geared masks. That particular one does spew out. You got to get the air out somewhere. So whatever, if you have an infection, the virus is going to come out. Everything is going to come out, whether you have staph, whether you have strep, whether you have H1N1, whether you have SARS, it doesn't matter. Being an infection control nurse, I wear little white gloves, and the reason I do is because everything we touch can be contaminated. I walked into the dentist office and there was all these people sitting in there and little kids, and it's like I'm touching the doorknob and I'm like, seriously? These little kids just opened the door and now I'm opening it up, and do I feel compelled to get out my disinfectant? And we know that that's not ideal. We know that hand washing is the cornerstone of all infection control programs. So that being said, I'd like to point out a few more things about masks from the Center for Infectious Disease Research and Policy. So a surgical mask will not approach the level of protection offered by a respirator mask. Many surgical masks have very poor filter performance. There's evidence from laboratory studies with coughing infectious disease subjects that surgical masks are effective in preventing emission of large particles and minimalizing lateral dispersion cough particles, but with simultaneous displacement of aerosol emission upward and downward from the mask. In total, the data suggests that surgical masks worn by the public will have no or very low impact on disease transmission during a pandemic. Very specific. There's also, my husband's going to read to you. I have to go to work, by the way. I do start at 11:30. I just texted my boss to tell her I was late, and I thought this was worthy of me being late, and she's very kind to me. And although I have a commitment to be on time for them, I did ask her to please forgive me for that. There's moderate evidence that surgical masks worn by patients in healthcare settings can lower the emission of large particles generated during coughing, and limited evidence that small particle emission may also be reduced. Most reviews have failed to find an advantage of one intervention over the other, but not. Okay, so the N95s have higher protection against clinical respiratory illness. Believe me, we all don't have N95s available to us, but not viral infections or influenzas.
I'm sorry, your time has expired.
Okay, may I conclude with one sentence?
I'll let you have one sentence.
I appreciate that. Masks may confuse that message and give people a false sense of security. If masks have been a solution in Asia, shouldn't they have stopped the pandemic before it spread elsewhere?
Thank you.
And that is the conclusion. I'd like to leave these documents with you, if I
And
could.
the deputy, he'll take care of that for you.
I'd appreciate it.
And then I'm going to ask Jeff Norton.
Thank you
Please come
very
forward.
much. I appreciate all of your attention, and I appreciate the care you're taking in conducting it.
Thank you.
Thank you, gentlemen, ladies. Jeff Norton, Charlotte County resident. That was my wife. That was right there. And I'm just going to use some things. There was a study done. This is from the CDC, and this is from a 201-page report. Page one. No, I won't read it all to you. But as they said here, even recently, there is no change in personal protective equipment. Surgical masks have occurred in the manufacture since that time. So the masks that we're using now are the same masks that have been around for decades. And then they said in the report, face masks, including surgical and procedure masks, loose-fitting coverings of the nose and mouth that are designed to protect the patient from secretions from the nose and mouth of the physician, nurse, or other healthcare professional. Face masks are not designed or certified to protect the wearer from exposure to respiratory hazards. They talk about they did this meta-analysis of risk ratios for the effect of a face mask with or without enhanced hand hygiene on laboratory-confirmed influenza from all of these randomized clinical trials of over 6,500 participants. And in the systematic review, the effectiveness of the face mask in reducing laboratory-confirmed influenza virus infections in the community from literature published. In a pooled analysis, they found no significant reduction in influenza transmission with the use of face masks. Yes, they might make you feel cozy, but they are rather ineffective. The wetter they get from us breathing in them reduces the effect of, enhances the effect of the transmission of whatever we've got going through the material. So the longer we wear them, the less effective they are. Thank you very much.
Thank you, sir. Next, we have Jerry Donafrio.
Thank you. My name is Jerry Donafrio, and I live in Port Charlotte, over on the peninsula. I went to the beach the other day, and I noticed that everybody was wearing a top if they were ladies, and everybody had bottoms on, and there was nobody there to enforce it, and everybody complied. Face masks are the same way. We don't need a cop up our behind in order to enforce a face mask. However, I didn't see anybody complaining about wearing all these things either, even though there's a lot of people that feel that face masks happen to be a violation of their constitutional rights. It's just a mental thing with a lot of people, and I think it's just a socially acceptable thing to have a mask on. Yet, in a store like Home Depot, while I'm shopping for some bolts and pieces and parts in a crowded aisle, 3 men will walk up to me, side by side, invade my space, coughing, laughing, having a good time. And what am I supposed to do at that point? Am I supposed to leave, or am I supposed to say, keep your 6 feet away from me? Or do we get in an argument? And that's usually what happens. What's my alternatives? I have none, really. And the reason I don't have any is because of the lack of governance. First, the president passes it on to the governor. Then the governor passes it on to the local municipalities. And everybody points a finger. And finally, local government says, we, the public, need to self-govern. All of us have to watch each other. Well, they watch me with a mask, and I watch them without a mask. That's not government. We, the public, need to self-govern, I think, is a joke. In the meantime, tens of thousands of cases of virus are being spread from person to person, not wearing a mask, under the storyline that it's unconstitutional for them to protect someone else or even themselves. Regardless, face masks do help. Here's the way I see it. The mess is not over. We have to live with socially responsible rules to wear a face covering to uncontrolled areas. We have trained police to enforce laws. We have expert fire officials to enforce safety codes. We have educated, doctorated environmental health officials to protect the public from illness. We listen to these people because they are the experts. Why is our government failing us by leaving life and death masks used for the responsibility of unskilled politicians instead of experts? If you think it's acceptable for your wife, your family member, or anyone else to be exposed to airborne microbes that could cause death or illness while simply shopping by an uncaring person not wearing a mask, then stand up. But if you feel that you want to protect these people, make us all safe, and please do your job. Thank you.
Thank you. Next we have Vicky, Annabelle 9. Vicky?
I had some literature I was going to read, but I think I'll just speak. I just think that personally, if somebody wants to wear a mask, they should wear a mask. If they don't, occasionally when I go out, if there's a lot of people or, then I'll wear the mask. But I really think that to mandate wearing a mask is not the answer. But just like this gentleman said, Joseph, there's a time and a place. I mean, I'm more scared for the kids at school, going back to school, than, mandating it. Like, I don't know, I've heard from 2 years and up, they're all going to be required to wear the masks, which it is really hard to breathe. And I just don't think the kids at anywhere from 6 or 7, 8 hours a day at a school, and then you have a lot of them stay after for daycare and stuff like that, that they're going to be able to wear the masks, like if they're mandated for the school. So that's really where I have a problem with it. I have 3 grandkids that live with me, and they don't want to wear them, but I'm like, you got to put them on, but so I don't know if there's a right answer or a wrong answer, but hopefully we'll figure it out, because, it's scary enough for these kids to have to go back to school in less than a month. And I even stopped at the school today just to pick up the kids' report cards, because they didn't even send them out this year. They were like, oh, they're online. Everything's online. And, I'm a grandmother, and I had to homeschool 3 kids, a kindergartner, a 2nd grader, and a 6th grader. And, I said to him, what's going to happen? She's like, I don't know. We don't know yet. We're going to start school in less than a month, and they don't even know the guidelines. So I know there's a lot of emotions, and, people want to wear them, wear them. But I see people driving down the road with these N95s on. I'm like, you're in your own car, and I don't see other people in there, or riding their bike, with a mask on. I think that's ridiculous, personally. I go for a walk every morning, 2 to 4 miles. I don't wear my mask, but you can see people, like, if you go by somebody, they step away from you. It's just common sense. And I do know personally a few people who have died of COVID. All my family is from New York. And, one was in a elderly facility, my brother's wife's grandmother. And, I know a lot of the younger people don't social distance, especially the teenagers and the early 20s. And, I know there was a spike when the bars opened, but I don't know. People have to take it seriously, but I think it should be your choice. All right. Thank you.
Thank you. Next, I have David Kalin again.
Morning, gentlemen. Dave Kalin, Charlotte County resident. I'm not here to pretend to be a doctor, a lawyer. I'm here to talk about experience. I feel like I got to carry this around. Even though nobody's legally allowed to ask me for it, I have a pre-existing condition that if I wore the mask, I've got a much higher risk of injury or death for wearing that mask. The reason I carry it, I've already gone into Punta Gorda. I've had stores refuse me service. I simply tell them I have a pre-existing medical condition. We don't care, I need to see a doctor's note. They don't have the right to ask for that doctor's note. However, now we're talking about law enforcement potentially enforcing this. I'm a little confused. When civil law started to be protected by police officers, I thought that was criminal statutes, state statutes, that the police enforced. So now I feel I've got to carry this so that I don't get arrested. That if I don't have it on me, and they say, well, put it on, and I don't have one to put on, or cannot put it on due to health concerns, am I now resisting an officer's direct request? I know it seems a little extreme, but we've seen it happen. This is not the only situation. I've had other individuals in public shame me. They don't know my condition. They don't know who I am. They don't know my background. They don't know my history, as I don't know theirs. I don't know the fear that they're experiencing personally. I know the fear I experience every time. It does not matter whether it's a young person, middle-aged, or elderly that gives me a hard time for not wearing a mask. I should not have to feel that I've got to justify myself to them why I'm not wearing a mask. Additionally, I've had people throw items at me and yell, put your mask on. I've had people spit at me. I've watched them take their mask off to spit. They're that angry over it. I've watched individuals at local grocery stores wearing their mask, yelling at people about wearing a mask, but when they go to open a bag, they lick their fingers and open the bag after taking their mask off. I'm a little confused on a lot of these people and where this is coming from, and it is fear. We've got to stop fearing this, pull together, come up with a solution that works. Mandatory is not a solution that works. They found that out in Prohibition. I think we use common sense. I think you direct people that this is probably your best course of action for those of you that are healthy enough to do so. But to mandate it, I think is an injustice and disservice to the people you serve. Thank you.
Thank you, sir. Next, we have Tammy Keelan.
I live in Punta Gorda.
Okay.
That was my husband that just spoke. I have something I want to read to you. I would ask that this board reconsiders this mandatory mask ordinance because of the unintended consequences that will occur. Just as those who are concerned about the virus have the right to protect themselves and they're free from prosecution from law enforcement, those of us with medical problems and conditions, or even those who choose not to wear a mask, should also be entitled to those same rights and free from prosecution from law enforcement. Recently, the city of Punta Gorda passed a mandatory mask ordinance. I have several members, not just my husband. I have 2 children with medical conditions. They have also been harassed and verbally assaulted. On a trip to the grocery store, I had no mask on, and a man rammed his cart into my cart on purpose. So, where am I at? No one has the right to ask for a doctor's note when any of my family members are out somewhere in public. That violates HIPAA and the American Disabilities Act. When you have a medical condition, wearing a mask can exacerbate that condition and can potentially become deadly as well. I am very, very concerned about the health and safety of anyone not wearing a mask given the current environment. Should you guys decide to pass an ordinance, the vilification and shaming of anyone not wearing a mask will be approved and stamped by this board. And it purposely discriminates against a group of people, whether they're not wearing a mask because they choose not to, or those without a mask for medical reason. I'm afraid for my one child who will be going back to school. Punta Gorda has already made it mandatory. I don't know how I'm going to send her back to school, even with her doctor's note, and all the other children are going to have to wear masks. She's going to be 16 years old. She shouldn't have to worry about that. That's not something she's going to school and having to defend why she's not wearing a mask and the rest of them have to. So I am pleading with you guys to not make this mandatory. If people want to wear them, they have that right. But don't take our rights away and put us in danger. Thank you.
Thank you. Next, I have John Harris.
Gentlemen, thank you very much. My name is John Harris. I'm from Charlotte County. I was pleased to see the doctor stand up here before you and talk about his surgical mask. This right here is from OSHA, and it states, surgical masks are not designed or certified to prevent the inhalation of small airborne contaminants. Surgical masks are not designed to seal tightly against the user's face. During inhalation, much of the potential contaminated air can pass through the gaps between the face and surgical mask. When you make everyone wear a mask, you need to tell us what mask to wear. For me to go out here in a surgical mask that does nothing and causes everybody around me to have a false sense of security is ridiculous. As far as when you talk about the doctor in his surgical mask, that's fine. If he wants to wear one, please wear one. If anyone in this room wants to wear one, if their masks work, they shouldn't be concerned that I don't have one on. It's that simple. When you talk about masks, you need to be sure that the mask you're wearing works. And no one can tell me for 100% positive that that mask is going to work. Every employer that requires people to wear a mask tells them what mask they're going to wear. And they do that through OSHA. If you guys want to have to tell me to wear a mask and mandate that I wear a mask, I feel that you need to tell me which mask to wear. Employers do it. Every employer a car painter, they are told what mask to wear while they're painting that car. If you guys want to tell us to wear masks, tell us to wear what mask, or tell us what mask you want us to wear. Because everyone wandering around in here in a face shield, their air is coming out the side. Everyone wandering around in here in a surgical mask, their air is coming out the side. The viral contaminants are so small that they're airborne no matter what. And to make me spend money to go buy a mask that doesn't work, and that's okay, doesn't make any sense. One other point before I leave. Orange County, California, just rescinded their mask requirements for most of those same reasons. Thank you, gentlemen.
Thank you, sir. Wanda Hayes.
Good morning. For the record, my name is Wanda Hayes. I'm a resident, homeowner, and taxpayer in Charlotte County. I'm here today to speak out against your proposed ordinance for face coverings. I would like to remind you that on June 20th, when speaking about masks, our governor said, and I quote, "This has to be voluntary because the Constitution is not suspended just because there is a virus." I find lines 36 and 37 of your proposed ordinance offensive. Those lines state, "Whereas neither the Constitution of the United States nor the state of Florida grant individuals the freedom to behave however they please." Now I ask, Do you consider the citizens of Charlotte County to be children that need to be told what to do? In your ordinance, Section 2, Paragraph 1, Standards for a Face Covering, you say a plexiglass face shield may be worn in place of a mask. How is a shield keeping air from escaping when it is open on the bottom? A face shield is made to protect you from blood and spatter. It is not made to protect others from your germs. Moving on to Section 4 of the ordinance, exemptions. Subsection 1, children 2 years of age are exempt and under. I would suggest this age, if you enact this, needs to be increased. Does the CDC or any of you have children? Do you have any idea how difficult it would be for 3 and 4-year-olds to be in a mask? Consider preschools where they're there for 9 hours a day. And then the question, is this going to be enforced in our schools? Are you taking that decision away from the school boards? Subsection 3 talks about existing health conditions, as the gentleman's already talked about. Some people are going to be exempt. How are they going to prove it? Do they have to carry a note from their medical or mental health provider? Doesn't the questioning people about these kinds of conditions violate Florida's Right to Privacy Act? What's to stop healthy people from saying they have a condition and just going about their business and not wearing the mask? Subsection 7, 8, and 10 talk about exercising, eating, drinking, and obtaining services. You say a face covering must be worn to ingress and egress or go to the bathroom, but not while sitting down doing your business, such as eating. Well, isn't that great? This virus is so smart, it knows not to bother me if I'm sitting down eating, but let me get up and go to the bathroom and boom, I've got the virus. Either you are inside a room spreading germs or you are not. This proposed rule would make no sense. I have watched several board meetings in the past 5 months, and I will point out that today, one of our commissioners, who is a doctor, has left this room 3 times without putting his mask on. So is this a rule that says, do as I say, not as I do? Do these rules apply to everyone equally? Section 6, enforcement. My question here was answered by the sheriff. He can't enforce this. He doesn't have the manpower to enforce this. And if he did have the manpower to enforce this, what would investigating look like? Somebody at the store calls and says, hey, there's this chick over here without a mask on. The code enforcement or the sheriff's office shows up, but I've got my mask on now. Then is it a he said, she said? Well, she didn't have it on when I called. I've been wearing it the whole time. Is there training involved in this? And let's talk about cost. Has anybody looked at the cost of manpower and paperwork in real dollars? We know everyone does not wear a seatbelt, so why do we think everyone is going to comply with this and wear a mask? Section 8, the ordinance expires in 90 days, unless you keep it going. This virus is not going to disappear in 90 days. There is not a vaccine. There is not herd immunity. There is not going to be herd immunity unless enough people get infected with the virus. So, does that mean we keep wearing our masks for 80 days, 90 days, 6 months, a year, maybe till after the election, 18 months, forever? I would like you to consider this like Florida's motorcycle helmet law. I personally would never ride a motorcycle with a helmet, but the law says I have a right to choose to do so. Thank you.
Thank you. Next, I have Al Foster.
Good morning, gentlemen. My name is Al Foster. I am a resident and a taxpayer here in Charlotte County. We've heard people say we should wear masks to protect ourselves. We've heard them to say we should wear masks to protect others. But who's making all of these suggestions? It's news TV anchors, radio personalities, medical professionals, governors, mayors, even councils. But why now? Why is this happening right now? Well, we hear of a big spike in coronavirus positives, but we're not being told the whole story, not even this morning. We don't know how many people are being listed as positives, but they're fine. They're not showing any symptoms, or maybe they've already gotten well, and they could be part of that herd immunity if we continue to spread this a little farther. On May 28th, NBC News reported that our Surgeon General said that the WHO, World Health Organization, the CDC, and his office have consistently recommended against the general public wearing masks. This was May 28th, not that long ago. Back in May also, the so-called guru of the COVID, Dr. Fauci, was told, he made mention on 60 Minutes, that face masks might make people feel a little better, but they simply don't protect people and instead bring unintended consequences, maybe a false sense of security. On May 28th, Fox News reported that the World Health Organization is recommending that healthy people, including those who don't exhibit COVID-19 symptoms, only wear masks when taking care of somebody that's infected. To be fair, June 9th, the WHO changed course, and they said in areas where the virus is spreading, people should wear fabric masks while they're in public if they're unable to practice social distancing. So what are we supposed to believe here? If it were up to me, given all the changes that we're seeing and hearing, I would probably suggest that the sick seek treatment, that those concerned about getting sick might sequester themselves, and for the rest of us, we get back to normal. I'd like to add, yesterday, my wife and I went grocery shopping down in Punta Gorda. We chose not to walk into the stores there because we were required to wear a mask, and my wife gets a little bit anxious when she covers her mouth. So we came up here, just around the corner, and we did our grocery shopping here. So if there's any doubt about this, let's err on the side of liberty. Thank you, gentlemen.
Thank you, sir. I have next Dr. Steve Jacobitus.
Good morning, Commissioners. My name is Dr. Steve Jacobitus. I moved to Charlotte County in March of 1990, and I had a dental practice here for almost 30 years until my retirement earlier this year. It's been a pleasure and a privilege to take care of the people of this community. What I'd like to do is I'd like to address this issue of face masks because I feel there's an opportunity for all of us here to take care of our neighbors. I'm a numbers guy. I've always been a numbers guy. So let's look at the national numbers first. The U.S. has approximately 4% of the population. However, it has 26% of the cases and 24% of the deaths in the world. Now, if you take a look at the curve, compare it to the European Union, from March through mid-April, those curves mimicked one another. Since mid-April, they're significantly different. The U.S. is now getting 50 to 70,000 cases a day, and the EU is getting approximately 4,000 a day. And in case you're wondering about the population, the EU has 117 million more residents than the United States. Next, let's look at the state of Florida's numbers. For most of May, we had less than 1,000 cases a day. For July, we're averaging 10,000 a day. Let's compare that to the state of Connecticut. They also had less than 1,000 cases per day for most of May, just like Florida did. For July, they're averaging approximately 77 cases per day. So in July, Florida has 130 times the new daily cases that Connecticut does. Granted, Connecticut has 1/6 the population, but this is 130 times different. The reason that I mentioned Connecticut is that I flew there in June due to a family emergency. It was quite different. Going into the grocery store, going into Walmart, going into Staples, easily 95% plus of the people were wearing masks. When I returned to Florida, my wife and I went to Walmart and we did a count of masks, no masks. Only 30% were wearing a mask. And when you're in a store, you know that you cannot maintain a strict 6-foot social distance. You would need 10-foot aisles in the stores in order to do that. So that's why I'm here today. I want to request Charlotte County mask mandate for all businesses with a roof overhead for both employees and customers. The medical experts have been very clear that wearing a mask, along with social distancing and hand hygiene, can significantly decrease the number of cases and deaths. However, some have said it violates their constitutional rights. This past Friday in Tallahassee, a circuit court judge ruled that the Leon County mask ordinance did not violate any constitutional rights and that it had a valid basis, which was to protect public health. As an analogy, people have a right to smoke if they desire. However, they cannot smoke in a grocery store, restaurant, the mall, etc. It would subject everyone to secondhand smoke and not protect the health of the public. The last thing I want in Charlotte County is a healthcare emergency. Our ICU bed capacity has been running at 80 to 90%. It won't take much for us to go over the edge. I thought I was done wearing face masks when I retired from my practice, but looks like coronavirus has changed those plans. Thank you, Commissioners.
Thank you, sir. Next, I have Mr. Tom Skaggs. I'll pull it to the side in case he shows up. Helen Mcmullen.
Hello, my name is Helen Mcmullen. I am here today not only on behalf of myself, but any other residents who feel the same way. When this whole thing started, many of us were confused and anxious about what was going to happen next. Yet we still went to school, went to our jobs, and provided the best we could while adapting to the CDC and FDOH guidelines. Excuse me. Then our school shut down and many of us lost our jobs or had to walk away in fear of spreading the virus to loved ones. Once the cases started going down, along with deaths and hospitalizations, we started to open back up and people started to return to work and get on with their lives. Then as the state started testing a larger percentage of the population, we saw a huge spike in cases. And then many counties in Florida started to enforce masks inside, and the state decided to put a mask advisory out to all residents. You may want to use some logic for that one, because statistically, the more people you test, the higher the numbers are going to be for positive cases. Like I said before, deaths and hospitalizations are on the steady decline. With only 79 deaths in Charlotte County as of yesterday and only 1,117 confirmed cases, I do not think this calls for an emergency mask mandate. There are around 189,000 residents of Charlotte County. That is about a 1 to 170 ratio. So I also want to point out that more children go missing in the United States every year than people have coronavirus worldwide. 800,000 children go missing every year, but only 571,000 people have died total of coronavirus. How come that is not the pandemic? Let Charlotte County residents have the choice to wear a mask if they want to or not. It is not in your authority to force people against their own beliefs to put a face covering on, which is not even intended to protect oneself. If you are afraid of a virus with over a 98% survival rate, then stay home. It is not okay to force people to stay home or fine or jail them for not wearing masks. This is not liberty, this is not choice, this is not freedom. America has and always will be the land of the free, So give me liberty or give me death, because I will not wear a face mask.
Thank you. Next, we have Stella Santa Tremblay.
Thank you for the opportunity to come and speak with you. I know nothing's going to be done how people wish, because it is a corporation that we're dealing with, a for-profit corporation. But anyways, I'm a great observer, and I've been looking around with people, including Stephen, with his mask. When you touch your hands with the mask, you got to wash it right away, because it's really crazy. The other thing is, did you notice that the doctor stated that when he wears a mask, he gets headaches, but he does it for the good of people? Humans were not meant to breathe their own carbon dioxide. It's not healthy. When you go out into the air and the sunshine, you take deep breaths, the virus dissipates. There have been thousands of people that have had coronavirus, but they've had antibodies. The other thing is, I would like to mention, why are Americans so skeptical of governments? We have the internet now. There's been thousands and thousands of professionals, doctors and nurses, that have tried to speak on YouTube, have tried to speak on Facebook, and they have been cut off. So where do we get a discussion like that? We know that the WHO is funded basically with George Soros, and if anybody wants to know what his background is, go for it. And Bill Gates. Do they have a vested interest in creating fear and creating all these things? Yes, he does. Now, I would like to take you to a time in history. Do you remember when American president declared a 3-day vacation? Unheard of. And everyone was so excited. And so they went out and they were celebrating. And unbeknownst to them, what was happening? The banks where their gold was stored was vacated. Do you remember that? I wasn't around, but we have enough of a history that these things have happened over and over again. People are starting to wake up because of the information we are given today. We know there's human trafficking. We know there's child sex trafficking worldwide. So we are going to be skeptical. Can I speak English? No. Whatever. We don't have confidence in our government anymore. And what people are doing now, we understand that we have to take back our political status from a corporation with an alt-cap name to the land and soil jurisdiction into which our compact belongs. We no longer going to listen to the governments that do not represent us. And this is a trend, and this is what's going to happen in the future. I yield. Thank you.
Thank you. Please. Next, I have one of the neatest handwriting individuals in the room, Tony Verone.
Thank you, gentlemen, for the opportunity to speak. Try to be neutral here, I think. I believe we as a community, as a nation as a whole, need to start thinking objectively, rationally, and logically, if that's even possible. The paranoia and fear fueled by journalists and the media have driven us so far from the facts and truth. It's no wonder that the majority of us, myself included, have difficulty discerning what's reality and what's not. I personally believe in results obtained from empirical data and facts. The data we are receiving here in the U.S. and around the world is conflicting, to say the least. Here in the U.S., federal programs, many we just reviewed earlier, other incentives, have even further skewed the data. One thing that is fact and has been proven with empirical data and evidence is that we as Americans are rapidly and fast becoming the most unhealthy societies in the world. My wife and I having the opportunity to travel to 10 different countries in the last 8 years, this is becoming more and more apparent. I'm all for respiratory protection when and where it's needed. From the time I first put on a gas mask in the U.S. Army,
to wearing half and full face respirators, SCBA gear, air supplied hoods, etc., nuclear plants, steel mills, refineries, oil fields, chemical plants, asbestos removal, and many other hazardous locations around the country. I take the use of respiratory protection and occupational health and safety very seriously. There are pros and cons to everything. There have been numerous studies as well as to the adverse effects of wearing respiratory protection. I believe these studies, documentation that's available, should be considered in the decision whether we should wear or not wear masks. One thing is certain, and it was mentioned before, is that the human body was never meant to have its airways obstructed any more than it was meant to use hand sanitizers repeatedly, drying out our skin, damaging our sweat glands, and other potential hazards. I believe the wearing of the face coverings should be a personal preference and that each and every citizen's choice should be respected. Simply stated, if you feel the need to wear a mask, then by all means wear one. If you don't, then don't. We all need to use common sense, practice normal hygiene, and take responsibility for ourselves. Thank you.
Thank you, sir. Next, also very neat printing, Polly Pierce. Polly Pierce.
That's me, but I didn't want to speak.
Okay, you didn't want to speak, and I'll just put it in the record that she is also against. And next we have Cheryl Johnson. Cheryl Johnson.
Good morning. I'd like to thank you for this opportunity. I had to mark down that I was in favor because my only other choice was to not be in favor. I'm actually ambivalent about this. I feel that some of the numbers that have been discussed earlier are wrong. I am a medical biller by profession. In fact, the nursing home that is designed as a COVID nursing home has 39 beds. 37 are currently being used, 14 by non-residents. So your gentlemen's numbers are not correct. My husband has very severe medical conditions. I wear a mask in public out of respect and love for my spouse. I wear it here out of respect for every single person in this room, whether you are for or against. Do I like it? Hell no. Do I like being told what to do? I am the most politically incorrect woman you will ever meet. With that being said, if you mandate it, I will wear it. If you don't mandate it, I will wear it. I will continue to respect the people of Charlotte County that I believe deserve my respect and my honor. Thank you.
Thank you. Next, we have John Saunders.
John Saunders here to speak with you folks. As a way of illustrating what you might be in for if you approve this mask mandate, one city from a neighboring county has passed such an ordinance. The City of Sarasota, ordinance number 20-5329, includes a section C, which is titled Exceptions. Exception number 8, the exception says, nothing herein shall require the wearing of face coverings by the following persons or in the following locations. Number 8 of the exceptions reads, persons whose compliance would be detrimental to their health, safety, or welfare. If this exception is being asserted for health reasons, the person asserting this exception is not required to carry or produce documentation verifying the health condition or to specifically identify the health condition to the compliance officer or law enforcement officer. Your legal department has likely acknowledged the need for such an exception. Despite this emotional propagandizing here in favor of mask wearing, We, the people, still have the right to decide for ourselves how we will live our own lives. As a part of the Charlotte County Assembly, my suggestion to you is that you think this through fully before making your decision.
Thank you, sir. Next, I have Michael Zarzano. Thank you, sir.
Good morning, County Commissioners. My name is Michael Zarzano. I am here with the Charlotte County Assembly. I would like to title this presentation, "The Focus and Perspective of the Mass Majority." There are 330 million people in America. 10% of that number would be 33 million. Keep in mind perspective, folks. Focus on the perspective here. 1% of the 330 million in America is 3,300,000. 1/2 of 1% is 1,650,000. So far, there have been 137,191 people that have died. Death is the issue. That's why we're here. That's why we're closing down businesses, because government is fearful of death. And we also don't want death. But let's get perspective. 1% is 3 million people. 1/2 of 1% is 1,650,000 people. What is 1/2 of 1/2 of 1%? And that's where we're at. 165,000 is 1/2 of 1/2 of 1%. The digital equivalent is 0.00041. This is the perspective that we need to recognize. More people die by snake bites, car crashes, drunk drivers. Are we going to stop driving? Are we going to shut down alcohol? Let's get real. Let's keep in mind, too, that right before this epidemic occurred, there were multiple arrests at university laboratories. Chinese nationals, one of whom was working for the military, the Chinese Communist Republic, the butchers of Beijing. Do you remember those people? They were arrested at Yale University. Why? Because they were smuggling multiple vials of virus back to China. One professor was arrested also. He had connections to Wuhan, China. This is being mysteriously left out of the evening news. But be alerted, folks. Just hours ago, Fox News is reporting that Florida is in trouble with their statistics. There are some suspicious activities with the statistics in the state of Florida. And this was just reported hours ago. The rate of infection is not the issue. That's what everyone wants to talk about, the rate of infection. No, it's the rate of death. It is the death threat that gets us to shut down our businesses. The rate of death is what we should be talking about, the 1/2 of 1/2 of 1%. We are on a path to creating a man-made depression that will make 1932 look like a picnic. Do you understand this? We are on the path to a biblical depression that will go down in the history books as man-made. The ma's and pa's all over this county and all over this state are going out of business daily because of the actions of tyrannical government that is basing their decision-making on fake science, fake news. The same fake news and the fake science that has been trying to destroy this presidential election's victory of Donald Trump. That's what this issue is all about. Sidney Powell, the highly credentialed and esteemed lawyer, this morning tweeted, "Do not wear a mask. It does not help and it's foolish. Stop the foolishness," she said. The fact is, long-term use of masks causes an unnatural consumption of carbon dioxide, as it has already been attested. This is unbelievable what is happening in America. Fear. Because of fear, these decisions are being erroneously made. And we are on a path to destruction, economic destruction, that will take decades to recover from. Do you not understand this? The Chinese Communist Party were arrested. A military officer was in our country helping to smuggle vials of the virus back to Wuhan, China.
No, your time
Yes.
expired, sir.
Tonight there will be a meeting. I'd like to invite every one of you commissioners to Inglewood Event Center at 6:30 for a town hall meeting.
Thank you, sir.
Thank you.
Next, we have Cynthia Compton.
Thank you. Hi, guys. So good to see you again. There's been a lot of information to take in today, trying to stay objective to some of the things that have been said. One of the biggest problems we have is mandating. The mandatings that happened and the statutes that happened a long time ago by taking God out of this country has put us in the position that we are in today. He is who I am under authority to. God and God alone. Somebody was saying how, you know, to think that man can govern himself is ridiculous. It is ridiculous that man doesn't know how to govern himself anymore because they have become so dependent on you. That's not your job. Your job is to make sure that our Constitution that is in Florida and in the United States is being upheld. That is your job, not to create more laws. And I mean, we have more laws that I sent you guys the statute 876.12 where it's actually statute against wearing a mask in public. Now I understand that's different than walking into a store or whatever, but you guys didn't even know that. You asked a specific question as to whether or not it is your position, if you have the legal constitutional right to do what you're planning on doing today. She said, I believe. There is nowhere written that you have the constitutional right to tell me what I can and cannot wear. There's an article for the U.S., how many are killed in a car accident. I have twice the chance of getting killed in a car going to buy masks than I do of dying from the virus that the mask is completely ineffective at protecting me from. How many people infected, and I tried to ask this to the gentleman who was up there with his very emotional testimony about people who are dying, and forgive me for my outburst, but this is a statistic that I have been longing for and asking for, and nobody ever wants to put it out there. How many people infected by the virus and how many people who have died by the virus were wearing a mask on a day-to-day basis? I have family. I was born in Miami. I have family still over on the East Coast. I went to visit my sister. I had to wear a mask just to walk into a restaurant to take the mask off to eat. I've worn a mask through this whole thing for those 5 minutes to order my food. It was so ridiculous. If you look at the numbers, Dade, Broward, Palm Beach County are the counties that have mandated the mask the longest, and they have now put Florida titled the epicenter for the virus. Because they're wearing a mask, they have completely enabled their immune system to be able to function the way God created our bodies to function. Now, you want to sit there and tell us for the next 90 days that we have to wear a mask? And those 90 days, what is going to happen to our natural ability to fight this virus? We take the mask off, and bam, there's another epidemic. We managed to survive the toilet paper and found out the hard way that that was not a cure to rid us of this. Guess what? The masks are just as effective as the toilet paper. Thank you.
Thank you. Next, I have, and I don't care which order, but I have Mr. and Mrs. Galper, Diana and Stanley.
Hello to you all. I'm Diana Galper, and I live here in Port Charlotte, and I'll speak very briefly before my husband does. I have a problem with my lungs per se where they're very weak, and if I get sick with this virus, I'm probably going to die. I wear a mask, and I'm not going after any statistical data, and I'm not belittling anybody, or I'm just speaking from my heart and with compassion. I too wear a mask to protect other people and also to protect me so I don't get sick and possibly die. I do everything the experts say I should do. I social distance, I wear my mask when I go out in public, and I wash my hands. I'm adamant about it. My husband and I have stayed home since March, only going out for necessities. And to put on a mask for 15 minutes to a half hour max when I'm out in public is a little price to pay, a very small price to pay for that self-assuredness of that maybe I won't get sick or somebody else won't get sick. I've been in many places where people do not social distance, they do not wear a mask, and I get scared. And that's why I'm wearing a mask. And I also wear a mask because I want to protect other people. I love people. And I'm always kind to everybody. And I want people out there to understand this isn't just about you as an individual. It's about all of us as a whole. It's about loving your fellow man enough just to wear that mask for a half hour to an hour max whenever you go out. And I'm pleading with you on the other side of the fence to please consider those of us who have immune systems that are somewhat suppressed, and to please consider the fact that we're here to love our fellow man, to try to help our fellow man. And however we have to do it, we need to do it. Thank you, gentlemen.
Thank you.